How is ADEM different from multiple sclerosis? Have you ever wondered how acute disseminated encephalomyelitis, often called ADEM, differs from multiple sclerosis? Both conditions affect the central nervous system and involve the immune system attacking the myelin sheath that protects nerve fibers. However, they are distinct in many ways. First, let's talk about the nature and course of these diseases. ADEM usually presents as a single, acute episode of inflammation. This means it often happens just once, frequently triggered by an infection or, in rare cases, vaccination. Recovery from ADEM typically begins within days, and most people see significant improvement within 6 months. In contrast, multiple sclerosis is a chronic condition. It involves multiple attacks or relapses over time, leading to ongoing damage and disability. MS can manifest in different forms, including relapsing, remitting, and progressive types. Next, we should look at the symptoms. Both ADEM and MS can cause issues like muscle weakness, numbness, and vision problems. However, ADEM symptoms often appear suddenly and can include confusion, fever, headache, nausea, and even seizures. These symptoms are less common in MS, where symptoms tend to develop more gradually and do not typically include fever or confusion at the onset. Age also plays a role in these conditions. ADEM is more common in children and adolescents, while MS usually affects young adults, although it can occur at any age. When it comes to diagnosis, there are key differences as well. Magnetic resonance imaging scans for ADEM often reveal widespread inflammation in the brain and spinal cord, with lesions that may resolve over time. In contrast, MS lesions are usually smaller and more defined, found in specific areas of the brain. Additionally, testing cerebrospinal fluid can show different markers. In MS, you might find oligoclonal bands and elevated immunoglobulin G, which are less common in ADEM. The presence of encephalopathy strongly suggests ADEM rather than MS. Finally, let's discuss prognosis and treatment. ADEM often resolves with treatment, such as corticosteroids, and most patients recover fully without lasting effects. On the other hand, MS requires long-term therapies to manage the disease and reduce relapses, and it can lead to permanent neurological impairment. In summary, ADEM is typically a one-time, acute event with a favorable recovery, while multiple sclerosis is a chronic disease with ongoing challenges. Understanding these differences is crucial for proper diagnosis and treatment. Always consult a healthcare professional for personalized advice and information regarding these conditions.